Myself, Muteep Shaukat Rishi. I am assistant professor at Khalsa College of Engineering and Technology, Ranjit Avenue, Amritsar. In this expo talk, I will discuss importance of radiology and scope of radiology. I would like to thank SS Career Solution Manipur for giving me this opportunity. So, what actually is radiology? Radiology, it's that branch of medical science that uses radio equipments that helps us to see the internal structure. So this radiology, it's that branch which uses radio equipments. So what is this radio equipment? These are the equipments. It includes X-rays, CT scan, MRI, ultrasound, fluoroscopy, mammography, DEXA scan, OPG, so on. So after this course, student will be labeled as a radiographer. ये कोर्स करने के बाद स्टूडेंट को रेडियोग्राफर करा जाएगा. So what is this? Who is this radiographer? He is a technologist. Radiographer is a technologist. His work is to operate the radio equipment and to handle the patient. So the role of radiographer is simply he has to operate the equipment, that is the X-ray machines, CT scan machines, mammography, X-ray, ultrasound, so on, and he has to handle the patient. He has to give the clear instructions to the patient. So in radiology, there are various equipments which radiographer has to use. So the first modality is X-rays. X-ray, it's a 2D modality. It helps us to see the internal structure. We can use it in various chest pathology like pneumothorax, pleural effusion, emphysema, dextrocardia, so on. But the problem, the disadvantage with X-rays, we can't be able to see the 3D image. And its solution was done by CT, computed tomography, which was invented by Sir Godfrey Hounsfield. So what is CT scan actually? CT, there are two terms, computed tomography. So with the help of computer, we can make slices. Slice, it's simply a cut section. The section, it may be axial. Axial means it's dividing the body into superior and inferior. Right to left, we can divide the body into right and left. And coronal, we can cut the body into anterior and posterior. So CT scan is that modality that helps us to see the 3D structures. We can use it in various pathologies. If there is any hemorrhage, if there is any stroke, if there is any pneumothorax patients. So CT, it helps us to see the 3D structure. The main difference between X-ray and CT is X-ray is a 2D and CT is a 3D. And another modality in radiology is that's ultrasound. So what is ultrasound? Its name indicates. Ultra means extreme. We are using extreme level of sound waves, extreme level of high frequency of sound waves that helps us to see the internal structure. So the principle of ultrasound is that is piezoelectric crystals. We have crystals. They are made up of, they are piezo crystals. We vibrate them and they give us the ultrasound. And then this ultrasound, it goes inside the patient and same ultrasound is reflected back and we can make an image. The one main thing, the advantage of ultrasound is that it's a very safe. It doesn't use ionizing radiation. We can use it in pregnant ladies also. So ultrasound is a very, very safe. Another modality is magnetic resonance imaging, which is MRI. So what MRI does? MRI, it uses a strong magnet and it uses a radio wave. So magnetic resonance, when there is matching of two frequencies, that is resonance. And with the help of magnet and radio waves, we can do the imaging of the body. Another benefit of MRI is that it uses also a non-ionizing radiation, which is the benefit of MRI. The disadvantage of MRI is that it's very expensive and it's prohibited in claustrophobia patients. They may feel some problem. Those patients which have a phobia of den-like structure. And another modality is mammography. So what is mammography? Mammography is the imaging of breasts. And one more modality, that is fluoroscopy. So what is fluoroscopy? Fluoroscopy is simply, if I give you a simple example, like if we take a picture, that is 2D modality. If we take a video, that's a live imaging. So X-ray, it's simply just to just to take a picture. And what is fluoroscopy? Fluoroscopy is to make a live video. Suppose doctor has to do a surgery, any surgery, they can't take a pic, they have to make a video. So fluoroscopy, it's used in operation theaters. So what is the scope of radiology? After the completion of radiology, BSc RIT, student can do job in X-ray, CT scan, MRI, ultrasound, mammography. Student can pursue various master's degree. They can go for MSc RIT, radiology and imaging technology. They can go for MSc radiotherapy, and they can go for nuclear medicine. So what is radiotherapy? What is nuclear medicine? What is their relationship with radiodiagnosis? Radiodiagnosis simply is that it helps us to see the internal structure. While as radiotherapy, its name indicates that we are giving high ionizing radiation, and therapy means treatment. So what is radiotherapy? Radiotherapy is simply that branch of medical science that uses high level of ionizing radiation to kill the tumor. It helps us to shrink the tumor. It has three types. First type is brachytherapy, when the source is very close to the tissue. Second is teletherapy. Teletherapy is when the source is very far from the tissue. And third is systematic. Systematic is when radioisotope is taken up by some system. So the equipments which we used in radiotherapy is linear accelerator, cyclotron. So if the student, he did MSc in radiotherapy, he has to work on linear accelerator, cyclotron and cobalt-60 machine. The third modality, the third option is nuclear medicine. So what is nuclear medicine? Nuclear medicine means, nuclear means something is coming out from nucleus. If we talk about radiation, X-ray is an extranuclear, while as gamma radiation, it's an intranuclear. So nuclear medicine means that something is coming out from nucleus. If we put this gamma ray inside the patient, it will go all over to the body. But we know this gamma ray, it's a harmful radiation. We want to restrict it. So we use a medicine. Nuclear medicine, there are two terms. What is nuclear? Nuclear means something is coming out from nucleus, that's gamma ray. And what is the role of medicine? It is taking this gamma ray to area of interest. Suppose in India, we use technetium-99m. This technetium-99m, it will give us gamma ray. And we have to restrict it to some area. We are using a medicine. Suppose I use MDP. What is MDP? MDP is methylene diphosphanate. We combine it with technetium-99. This MDP, it will take this gamma ray to only bone cells. If I use another medicine, DMSA, dimercaptosuccinic acid, it will take this gamma ray to only to renal cells. So nuclear medicine, it's using a gamma ray and it's using a medicine. So what is the role of medicine? It's simply taking this radiation to area of interest. So the modality which we use, which student has to use in nuclear medicine is, first is gamma camera. So what is gamma camera? When we inject the technetium-99 plus some medicine, the radiation will come out from the patient. In radiodiagnosis, the source was outside. The radiation was coming from outside. But in nuclear medicine, the radiation is coming from inside. So there is one equipment which receives this radiation, that is gamma camera. If we combine this gamma camera with this CT scan, it becomes a SPECT. So SPECT is a 3D modality, while gamma is, that is scintigraphy, it's a 2D modality. Another equipment which students have to deal with, that is PET. So what is PET? PET is positron emission tomography. Its principle is, depends upon two principles, that's Warburg effect and another is annihilation coincidence reaction. So Warburg effect simply states that whenever there is a tumor cell, glucose will be accumulated more in tumor cell. And what is annihilation coincidence reaction? When positron reacts with electron, it will form two gamma rays. So what we did, we take a glucose and we remove the oxygen from glucose. It becomes deoxyglucose. And we place the 18F. What is 18F? It's a positron. That becomes 18FDG. So when we inject this 18FDG into the patient, the tumor cell, as per Warburg effect, it will accumulate all the glucose. There remains 18F. This 18F is a positron. it will react with nearby electrons and it will form two gamma rays that will be detected by detectors. So let me conclude this export talk. I discuss the radiology, which is simply we use radio equipments that helps us to see the internal structure. The student will be labeled as radiographers. They have to handle the X-ray machine, they have to handle the ultrasound machine, they have to handle the MRI machine, they have to operate CT scan, mammography, fluoroscopy, DEXA, so on. And students can pursue masters in radiodiagnosis, nuclear medicine, and radiotherapy. In radiotherapy, I told you that it uses high ionizing radiation to shrink the tumor, to reduce the tumor. There's three types. One is teletherapy, brachytherapy, and systemic therapy. And this nuclear medicine, it's using gamma ray and a medicine. The role of medicine is to take this radiation to area of interest. And the equipment of nuclear medicine is SPECT, gamma camera, and positron emission tomography. So the eligibility for BSc RIT is students having 10+2 with physics, chemistry, and biology with percentage of more than 55%, they can easily go for BSc RIT. While as the eligibility for MSc RIT is having the BSc in radiology or any related degree to radiology, they can easily go for masters in radiology and imaging technology. Thank you.